First, I'm going to be doing a QSEN on Mr. Logan. I'm going to check his wristband, make sure his name and date of birth is correct. And then I'm going to check the whiteboard and make sure that the names and everything is updated. I'm going to check for any tubes. He doesn't have oxygen on, he doesn't have an NG tube, he doesn't have a Foley catheter, and no chest tubes. He does have a right AC saline lock. And he has 3 side rails up. His bed is in the lowest position. He has his call light within reach. Water if needed. His urinal is over there, and there's no obstacles in his way. So now I'm going to do a head-to-toe assessment. So, hi Mr. Logan, I'm Grace. I'm going to be your nurse today. I'm going to do a head-to-toe assessment on you real quick. I'm going to wash my hands, get some gloves on, and I'm going to get vital signs. The patient seems drowsy and fatigued. I'm going to check his pulse bilaterally. They're present. His pulse is rapid and weak, and it is 87. I'm going to check his respirations now. He is breathing very deep and has a very increased rate at 32. I'm going to now check his blood pressure on his right arm lying, and it is 132 over 77, and his pulse ox is 96%. I'm going to check his skin. It is pink. And check his feet skin too. It is pink and dry. I'm going to check his turgor on his chest. It is poor. Are you having any pain? He denies pain. Can you tell me your name? Mr. Logan. Okay, do you know where we're at? Do you know we're at the hospital? Do you know the time? No? Okay. So he's alert and oriented ×2. Can you squeeze my fingers for me? Okay, can you push against me? Can you pull against me? And can you wiggle your fingers? He's able to do all that. I'm going to check your pupils. Will you look straight ahead for me? He has Perla. Now I'm going to check his lungs out. I would ask him to sit up for me, and I would check his chest symmetry. Will you take a deep breath in for me? It's symmetrical. And then I would listen to his lung sounds. Take a deep breath in every time my stethoscope touches you. They're clear to listening, but he has rapid breathing. He's breathing very heavily. Now I'm going to check his apical pulse, the clavicle, mid-clavicular line. Okay. I would listen for a full minute. S1 and S2 are present. I would check his JVD sitting up. There's none noted, and then I would lower the bed down. Also none noted. And now I'm going to try the 6 P's and extremities. I would check his pulses in his feet. They are both, pedal pulses are both present. There's no puffiness. Can you wiggle your toes for me? Can you push against my hands and pull against my hands? Okay. Is there any numbness or tingling in your feet? No? Okay. Any numbness or tingling in your fingers? Oh, I would check his cap refill on his feet as well. It is less than 3 seconds. I would do that in his fingers as well. All right, now I'm going to I'm going to take a look at your stomach. All right, I'm going to listen to all 4 quadrants. Any pain in your stomach? Okay. A little bit of pain. Okay, you've been having flu-like symptoms. Okay. When was your last bowel movement? Yesterday? Okay. So his bowel sounds are active in all 4 quadrants. Are you having any pain, itchiness, or burning when urinating? No? Okay. And then I would check his right IV site for any redness or irritation. There's no redness. And then I would, so based on his assessment, I think the patient is in diabetic ketoacidosis and in a hyperglycemic state, based off of him coming in with decreased level of consciousness, rapid breathing, and fruity breath. And he has a history of type 1 diabetes. I would expect a full CBC panel, arterial blood gases, and a stat blood sugar level. Also a potassium level drawn. So his POC glucose was greater than 450, which was the meter max. So what's going on with him is he's having tissue starvation. His ketones are released into his blood, causing acidosis. Our number 1 priority is to decrease Mr. Logan's blood glucose level and to rehydrate him as soon as possible. And I would start the IV of normal saline and give him his insulin based on the doctor's orders.